This is a gentleman who's we're trying to investigate for a mass on a bioprosthetic mitral valve that was put in less than a month ago. So let's start here, Amber. Let's take a 4-chamber view, please.
Yep.
Now, really, really important to note that if we show here, there's actually a marked reverberation shadow. And the shadowing artifact is going to limit, so this is a shadowing artifact, not a reverberation, is going to limit your ability to see anything in this field of view. Something important. Now, we're going to start from the top. So let's take that there, and you can see something immediately flicking there. So that's almost at the commissural level, or where the valve strut is. We'll just give him a bit of a jaw thrust there. He was just obstructing a little bit there. Let's take that there. Now, as I go in, now the same geometry does not apply, because instead of having a bileaflet valve which had cusp, you have usually a trileaflet aortic or mitral valve stitched into that position. So let's go through, let's take that there. So we saw something at this commissural point here. Take that, please, Amber. We're going to look at that in more detail. Take that there. Let's go in, take that there.
There are multiple lesions, aren't there?
Yeah, and so we now start seeing something flicking around the septal side. Take that there. So let's go through. That's just the struts. And we come through. Take that there. Now, interesting. So what I'm going to do, Amber, is, here we go. You see something else on the septal side as well. So just there. Now, can I get you to narrow my sector width, please, Amber? And a little bit wider first. So we'll do a color. So let's start from the top. Let's take that there, and you can see that lesion color on it. You know, it looks a little bit smaller, actually, son, which is good. Let's take that there. So for reference, we have scanned this patient before, because we had differentials, which was whether it's a thrombus or a vegetation. Take that there. Take that there. I'm looking also to see if there's rocking or if there's a periprosthetic leak. Let's take that there. Take that there. And you need to have a wide enough field of view beyond the stitching. Take that there of the valve strut. So just a bit wider in terms of our color flow and our window, please, Amber. Take that there. Just to see if we've got a... Yep. And a little bit wider now. As we go wider, though, we are dropping our frame rate. Let's take that there. So there's a trade-off to be had. Let's take that there. Okay. And take that there. Okay, 2D. Now let's go right to the top. Can I get you? So there's the appendage. So let's take that there, Amber, and narrow my sector width, please. Now, just before you do, go nice and wide. And so at 50 frames, you can see the lesion. Let's take that there. Now, as you narrow it, I'm going to go to at least about 70, 80 hertz. Narrow my sector width. Keep going, keep going, keep going. You get to see it. Just obstructing again. Can we just give him a jaw thrust? Thank you. Let's take that there. So you get to see it in much higher resolution, and you get to see it moving independently. Yeah, see that there. Take that there. So you actually see 1, 2, 3 little, all of them interconnected, but it's not just one thing flicking through. And that's the advantage of higher frame rate imaging. We're at 103 hertz. Can you zoom in for me, please, Em? And I just want to focus on that. Here we go. Take that there, and you can see that looping motion.
And that's the independent motion.
Yeah, absolutely. Yeah. Let's take that there.
So it's optimizing imaging for high frame rates, doing sort of pre-processing zoom is the way that you get that maximal.
Absolutely. Zoom and the key component, if you saw with zoom, our frame rates didn't go up, but it was the narrowing of the sector width, because that's the amount of lines per second that have to be refreshed. Let's take that there. Yeah. All right, now can you do a live 3D there for me, please? Now the good thing is, and here we go. Let's take that there. Now reduce your 3D gain. So Sam, if you have a look here now, normally for vegetation they're hard to see, but if you see I've got frame rates of 50 hertz per second. So what you can see is actually the nature of the mass. Yes. And you can see it moving around. So, and you see it in its volume. Okay, so now let's zoom in. Amber, now we're going to go to the one closer to the aortic valve and the septal side. So really, yep, and just zoom in there for me. Here we go. Let's take that there. So do you see that there now? Yeah. And again, once we're at 110, so we couldn't see it as well before. The zooming has helped, but really it's being at the 110 frame rates. Let's take that there, please, Amber. The other key issue with valves is you can't just go to pre-specified views, i.e. 4-chamber, 3-chamber, 2-chamber. You need to, I go up in incremental steps to make sure I don't miss anything else. So let's take that there.
And this is particularly for prosthetic valves?
Yeah, just because there's so much reverberation and shadowing, it's easy to miss something. This is a view at about, I think, 50 degrees where we can resolve both of them. There we go, let's take that there. So you've got actually one here, and then you've got another one on that little valve strut. So, you know, the differential is going to be a very slow fastidious organisms, the HX group of organisms, fungus, or a cornybacterium, color off, or it's some thrombus. And you know why? He's aggressively thrombotic and he's on anticoagulation. So now I'm going to increase my angle here, and you get to see the one on that lateral side close to the appendage a lot better. Okay, increase my angle to 90, color off. So, yep, take that there. Okay, let's take that there. Let's take that there. So this is in your long axis view. Now this view is really important because you're going to see if we anti-clockwise and rotate, you're going to see the lateral one. There you go. But if I rotate clockwise, you're actually going through a different plane, and then as you see the aortic valve, you're going to see the more aortic medial one. So I've actually rotated through the whole valve. And now let's do this with color to make sure, and really we have to pay specific attention to that aortomitral curtain. The for vegetation, it hasn't, if it is indeed that, we haven't seen it eat through the valve. Let's take that there. And do M mode first. Beautiful. I just like how it looks. Freeze, let's take that. And pulse wave there. Beautiful. Let's take that. Freeze. And let's do a CW. So you're getting a bit of ghosting there, freeze. You will actually measure the dense part, so the chin, not the beard. Okay, now we're going to do 3D. So I'm going to go into what I call is the bichromatral view. So we're optimizing the TGCs at the level of the valve. Good. Okay, now 3D zoom, please. Okay, and bring it down, flatter and wider. Yep. And a bit lower, please. Yep, and now I would actually change elevation position first to center it a bit. Good, and now wider. A little bit wider to get that aortic valve cusp. Yep, and now click 3D zoom. Scroll the ball down. Beautiful. So you see all three leaflets. Let's take that there. Acquire first. Now I can see at about 5 o'clock one of the regions, but it's not very well resolved. So the next thing you want to do is go to 3-beat output and change it to HVR. And it gives you a bit more temporal resolution. After this, what we want to do is go to image quality and go to frame rate plus. And it gives us a bit more, but we're losing it. So here we go.
A little bit of resolution, but get better frame rate. So you can see those independently mobile structures.
Let's take that there. Now, if you go back to image quality and just go to frame rate 1, so you get a bit of a trade-off. And you can see around that 7 a.m. mark. Let's take that there. Now, color there, please. Let's take that there. So there's no leakage and there's no periprosthetic leakage as well. Okay, color off.
Beautiful 3D pictures.
Now, if you go to true view for me, and let's take that there. Now, we've got a bit of dropout. So what I can do with this is increase your compress, Amber. And it starts filling those gaps, basically. So and you actually start seeing the vegetation there as well. Take that there. Do you guys see that at the,
about the
5:30 mark?
Yeah.
Okay, so appendage, let's open it up. There's your appendage, let's take that there. Color on the appendage. Explain. Let's navigate through the appendage, let's take that there. We will look at the pulmonary venous flow too. I haven't seen any mitral regurgitation, but sometimes if I see flow reversal, it tells me to go look harder, 2D. Remember 110 degrees clockwise, so this is really nice. Less upper, lingular, and lower. So almost a trifurcation. Let's take that there. Pulse, any of them. It's nice blue, which would suggest SDAR. There we go. Gorgeous. And you can see upper, lingular, lower for the left side.
Yeah.
And then if we go through, now you do also see a little bit of a pericardial effusion around there, that little gap. And if we go to 70 degrees, rotate.
Pericardial recess, but it's small.
That's right, it's small. And then you get the trouser legging of the right upper, lower, and middle. So you see the trifurcation there. And pulse those for me. Any one of them will do. So if you've got a nice aortic valve and if you go live 3D, you get decent images. Take that. But if you go off live 3D, the way we can optimize it, firstly, is to narrow your sector width. Yep. Center the aortic valve. Good. focus position is appropriate. Just improve the TGCs at the level of the aortic valve. Good, nice. So already your 2D image is better. Now if you go live 3D, you're going to get a much better result. Now what I want you to do here is reduce your elevation width for me a smidge. Increase it back up, so we're losing space there, so elevation width is key. Scroll the ball to the right. There we go. So you get an on-fast view of the aortic valve.
Oh, very nice.
Here we go, that's nice. Now what I want you to do is increase your compress a little bit. Good, and reduce your 3D gain a smidge. Nice, a bit more. Take that there, beautiful, take that there. Now what I want you to do is go to image quality and go to resolution. And that gives you a bit more depth of texture and resolution of the thin aortic valve. Let's take that there. Then if you go color, and we're imaging at 70 Hertz, let's take that there. Gorgeous, wow. Color off. Now here, Amber, one thing I want you to do is put color on, go color compare. So one of the things that are often missed, let's take that there, is the aortomitral continuity as you go higher up, this area, because people often don't look. So take that there, and if you've got something, take that there. So I'm going up all the way almost to the pulmonary artery to make sure I haven't missed anything else. Take that, 2D. And you can see because that vegetation is going to be just here. So it's actually fairly high up near that appendage. Yeah. Okay, and now aorta and out. Explain, please. Let's take, freeze, empty your cachet. You pull out slowly, slowly. There's some atheroma there. Not just simple, not complex. Let's take that there. Slowly, gently rotating so we keep it centered. Take that there. I'm rotating clockwise as I come through, and we are out.
Faraz, Amber, thank you very, very much indeed. And just again, thanks again to the patient.
No, pleasure.
Thank you, guys. Thank you.